Avoid eating broccoli if you suffer from these 5 health problems. Did you know that eating too much broccoli could harm your health if you have certain medical conditions? We've always been told broccoli is one of the healthiest foods out there. And yes, it is packed with vitamins, minerals, and antioxidants. But most people don't talk about the fact that broccoli may make existing health problems even worse. In this video, I'm going to tell you exactly why you should avoid eating broccoli if you suffer from these 5 specific health problems. From thyroid issues to kidney stones and even blood thinner interactions, the risks are real and backed by science. Always consult your doctor or a registered dietitian before making any major diet changes. Now, let's begin by discussing when people should avoid broccoli. 1. Hypothyroidism. If you've been diagnosed with hypothyroidism, you might want to think twice before piling your plate with broccoli, especially if it's raw. One of the biggest culprits is a compound called glucosinolate, which your body breaks down into substances known as goitrins. These goitrogens may slow down the uptake of iodine into your thyroid gland. That matters because without enough iodine, your thyroid can't produce the key hormones T3 and T4. That slowdown may leave you feeling more tired, cold, and mentally foggy, symptoms that might already be troubling you if you have hypothyroidism. This interference becomes even more noticeable when you eat broccoli in large amounts or on a regular basis without cooking it, since heat reduces the potency of these compounds. An additional concern is sulforaphane. While it's often praised for its antioxidant and anti-cancer benefits, sulforaphane also affects phase IA detoxification in the liver. For someone with a sluggish thyroid, this may disrupt the hormonal balance further because the liver plays a big role in converting T4, the inactive form of thyroid hormone, into T3, the active form your body actually uses. If liver detox pathways are overstimulated or unbalanced, it may leave even less usable hormone circulating, making your symptoms harder to manage. According to Science Direct, broccoli sprouts may exert a negative influence on thyroid function as they are a rich source of glucosinolates, in particular glucoraphanin. 2. Irritable bowel syndrome. Broccoli might seem like the kind of vegetable that's supposed to help with digestion, but for people with IBS, it may actually do the opposite. The main issue starts with a group of carbs known as FODMAPs, and broccoli, especially the stalk, is high in one called raffinose. It's a complex sugar that your small intestine doesn't absorb well. Instead, it travels down to your colon, where it's rapidly fermented by gut bacteria. This fermentation process creates gas, and that gas stretches and pressurizes your intestines. For someone without IBS, it might just be mild bloating, but for you it may trigger severe cramping, pain, and irregular bowel movements. That's because people with IBS often have a more reactive gut lining and altered nerve signaling that exaggerates how your body responds to gas and stretching. Broccoli also contains polyols, specifically mannitol, which is another poorly absorbed sugar alcohol. Just like raffinose, mannitol pulls water into your intestines and gets fermented by bacteria, leading to even more bloating and gas. But polyols also cause a rapid shift in fluid movement, which may trigger loose stools or urgency out of nowhere. For someone with IBS, that unpredictability isn't just uncomfortable. It may really disrupt your day. According to PubMed, a low FODMAP diet is now a leading treatment for managing IBS symptoms. 3. Kidney stones. For someone prone to kidney stones, especially calcium oxalate stones, broccoli could quietly be working against you. The naturally occurring compound oxalate is one of the main concerns. Broccoli contains a moderate amount of it, as do many plant foods. When oxalate pairs up with calcium inside your kidneys, it may form sharp, crystal-like structures. Over time, these crystals may grow into stones that get stuck in your urinary tract. The sharp, stabbing pain most people associate with kidney stones is caused by this blockage. Even though broccoli isn't the highest oxalate food out there, eating it regularly, especially in large servings, may add to your overall oxalate load, which matters a lot if your body already struggles with getting rid of it. The amount of potassium should also be a concern. Broccoli is naturally high in potassium, which is usually great for blood pressure and heart health. But if you have compromised kidney function, or if your doctor has warned you to watch your potassium intake, this may be a problem. Your kidneys are responsible for filtering out excess potassium, and when they don't work properly, potassium may build up in your blood. That may throw off your electrolyte balance, affect heart rhythm, and make stone formation more complicated by interfering with the kidney's ability to regulate minerals. According to PubMed, higher potassium intake may help slow early CKD progression. 4. Blood thinner therapy. If you're on blood thinners like Warfarin, you might be surprised to learn that something as simple as eating too much broccoli could throw your medication off balance. The biggest concern is vitamin K1, which broccoli has in high amounts. Vitamin K plays a key role in helping your blood clot. That's normally a good thing, but if you're on a blood thinner, your goal is to slow down clotting to prevent strokes, heart attacks, or complications from existing clots. When you suddenly increase your vitamin K intake by eating a lot of broccoli, it may reduce the effectiveness of your medication. That may lower your INR levels, which is how doctors measure how thin your blood is, and make your body more prone to forming clots, exactly what you're trying to avoid. One more thing to think about is being consistent. One of the things doctors emphasize when you're on blood thinners is maintaining a steady amount of vitamin K in your diet. Broccoli, being nutrient-dense, may create issues if you eat a lot of it one week and then skip it the next. That uneven intake may cause your INR to bounce around unpredictably, making it harder for your healthcare provider to manage your dosage. When INR levels fluctuate too much, you're at risk for either excessive bleeding or dangerous clotting, depending on which way the numbers swing. According to the National Institutes of Health, excessive vitamin K intake might lead to excessive bleeding. 5. Autoimmune diseases. Broccoli, while packed with health-boosting compounds for most people, may actually stir up trouble for those with autoimmune conditions. It's not about the food being unhealthy. It's about how certain elements in broccoli interact with an immune system that's already misfiring. Sulforaphane is one of the broccoli compounds that has received the most attention. This molecule is known for activating detox pathways and reducing inflammation under normal circumstances. But in someone with an autoimmune disorder, that activation may go too far. Sulforaphane stimulates certain immune pathways, which are involved in both protecting cells and signaling inflammation. In a healthy body, that's a balanced response. According to research, sulforaphane in broccoli helps reduce inflammation by blocking certain pathways, which lowers pro-inflammatory cytokines. But in autoimmune diseases like lupus, multiple sclerosis, or rheumatoid arthritis, those same pathways may be overly sensitive. More inflammatory cytokines, increased immune cell activity, and possibly even triggering or worsening a flare-up. In addition, the phytochemical, which is formed during the digestion of broccoli, has an immune-modulating effect. It interacts with estrogen receptors and influences hormone metabolism, which may seem unrelated at first, but hormones play a key role in many autoimmune conditions, especially in women. When you alter hormone signaling in a system already prone to imbalance, it may make autoimmune symptoms more erratic. It has also been shown to influence T-cell regulation, which may be risky when your body is already producing too many rogue T-cells attacking healthy tissues. Now that we have discussed the problems of eating broccoli for certain individuals, let's talk about the amazing health benefits of broccoli. 1. Supports heart health. Most people look at it as just another green vegetable, but the compounds inside broccoli go far beyond basic nutrition. They actually work on multiple levels to support your cardiovascular system, keeping your arteries flexible, reducing inflammation, and even helping your body manage cholesterol more effectively. Glucoraphanin, a nutrient found in broccoli, is transformed into sulforaphane by your body. This powerful compound activates a defense pathway in your cells called NRF2, which helps lower oxidative stress, a key factor behind damaged blood vessels and plaque buildup. Sulforaphane also supports your blood vessels by reducing inflammation in the endothelial lining, that thin layer of cells inside your arteries that controls blood flow. When the endothelium is inflamed, it makes you more vulnerable to atherosclerosis, but compounds in broccoli help keep it stable and functioning properly. And then there's potassium, a mineral that's essential for maintaining a healthy heartbeat and normal blood pressure. Potassium works by helping your kidneys flush out excess sodium, which is a major trigger for high blood pressure. At the same time, it supports the balance of fluids in your body and ensures that your heart muscles contract properly. Since broccoli delivers a natural dose of potassium without the excess sodium you find in processed foods, it becomes a smart choice for keeping your blood pressure in check. According to research, broccoli helps protect against cardiovascular diseases by reducing inflammation and oxidative stress. Its bioactive compounds support heart health by improving blood pressure, cholesterol, and other related markers. 2. Boosts immune function. If you're looking for a natural way to keep your immune system strong, broccoli should definitely be on your radar. The plant pigment beta-carotene, which your body converts into vitamin A, is one of the most potent immune-boosting components in broccoli. This nutrient is critical for maintaining the health of your skin and mucous membranes, which act as the first physical barrier against germs. But beyond that, vitamin A helps regulate white blood cell activity, especially T cells and B cells, which are key players in identifying and destroying harmful pathogens. Without enough vitamin A, your immune response may become slower and less effective, making you more vulnerable to common colds and more serious infections. Broccoli also delivers a beneficial dose of selenium, a trace mineral that might not get much attention but plays a major role in your immune system's ability to launch a strong response. Selenium helps regulate the production of cytokines, molecules that guide immune cells to the site of infection. It also supports the creation of antibodies, which are like targeted missiles against bacteria and viruses. Low selenium levels are linked to reduced immune function and slower recovery from illness, so having a food source like broccoli in your meals helps fill that gap naturally. According to research, sulforaphane from broccoli supports immune health by activating NRF2, which boosts antioxidant and detoxifying enzymes. Its high bioavailability makes it effective in immune-related conditions, with clinical trials showing promising results where some drugs fall short. 3. Improves bone strength. When people think about building strong bones, they usually jump straight to dairy. But what many don't realize is that broccoli packs a serious punch when it comes to bone health. One critical element is magnesium, a mineral often overlooked in bone conversations. Magnesium supports the activity of osteoblasts, the cells responsible for building new bone tissue. It also helps regulate the levels of parathyroid hormone, which controls how much calcium stays in your bones versus how much gets released into your bloodstream. If magnesium is low, bone breakdown tends to outpace bone formation. Broccoli supplies this mineral in a form your body may absorb easily, which gives your bones the support they need to stay strong as you age. Furthermore, broccoli also contains phosphorus, a mineral that works alongside calcium to form the structural framework of your bones and teeth. Phosphorus combines with calcium to create hydroxyapatite, the mineral complex that gives bones their hardness. Without enough phosphorus, even with plenty of calcium, your bones may become brittle or improperly formed. What makes broccoli especially valuable is that it offers this mineral naturally, without the excess acidity or additives found in processed foods that may weaken bone density over time. According to Science Direct, broccoli and fermented broccoli may reduce bone loss linked to a high cholesterol diet by lowering serum lipid peroxidation. 4. Supports detoxification. If you're trying to clean up your body from the inside out, broccoli might just be one of the most powerful tools in your kitchen. Detoxification isn't just about juice cleanses or expensive supplements. Your body has its own built-in detox system, and it needs the right nutrients to run smoothly. Broccoli helps support that system at the cellular level, especially in your liver, where toxins are processed and eliminated. And the compounds in this green veggie don't just support the process. They actively kickstart it. Broccoli contains several detoxifying phytonutrients, but one of the most potent is glucobrasicin, which your body transforms into indole 3-carbinol. This compound plays a key role in regulating detox enzymes in your liver, especially phase 1 and phase 2 detox pathways. These are the two major stages where your liver first transforms harmful substances and then binds them to molecules that make them easier to flush out. Without this two-step process running efficiently, toxins may linger in your system, increasing inflammation and hormonal imbalances. Broccoli helps activate this process naturally, giving your liver exactly the kind of support it needs to work better, not harder. Moreover, chlorophyll, the plant pigment that absorbs light, is another detoxifier found in broccoli. In your body, chlorophyll acts like a sponge for toxins, particularly heavy metals and environmental pollutants. It binds to these toxins in the digestive tract and helps prevent them from being absorbed into your bloodstream. This natural binding process gives your gut and liver a break and allows for cleaner elimination through your stool. It's a quiet, powerful way of helping your body filter out substances that don't belong there. Also worth highlighting is the fiber content in broccoli, which plays a direct role in detox by keeping your digestive system moving. Toxins that are processed in the liver eventually get sent to your intestines for removal, and without enough fiber, they may sit in your gut and get reabsorbed into the bloodstream. That's where broccoli's combination of soluble and insoluble fiber comes in. It helps form bulk, supports regular bowel movements, and reduces the time waste products stay in your system, essentially speeding up your internal cleanup crew. It's a natural way of making sure your detox process doesn't stall or backtrack. According to the World Journal of Gastroenterology, broccoli sprouts are rich in glucoraphanin, which converts into sulforaphane, a potent natural compound that activates liver detox enzymes. This enhances glutathione production and helps protect the liver from drug-induced injuries like those caused by acetaminophen. 5. Promotes healthy digestion. When it comes to supporting healthy digestion, broccoli might not be the first food that comes to mind, but it should be. This vibrant green vegetable is loaded with compounds that do more than just fill your stomach. It actually helps your gut work better from top to bottom, supporting everything from stomach acid production to the health of your gut lining. The high concentration of sulforaphane, a sulfur-based chemical that aids in protecting the lining of your stomach, is one of the main digestive benefits of broccoli. This compound encourages your body to produce enzymes that fight off harmful bacteria like Helicobacter pylori, which is known to disrupt stomach function and even lead to ulcers. By reducing bacterial overgrowth and supporting your gut's natural defense systems, sulforaphane creates a more balanced environment for digestion to take place. Broccoli has a high insoluble fiber content and a natural fiber profile, both of which are beneficial to digestion. This type of fiber adds bulk to your stool and helps it move through your digestive tract more efficiently. It acts almost like a broom, sweeping waste through your colon and keeping things regular. Regular bowel movements are critical for preventing bloating, gas buildup, and toxin reabsorption in the intestines, and broccoli gives your body the raw material it needs to make that happen smoothly and consistently. According to the National Library of Medicine, broccoli consumption significantly shifts gut microbiota in healthy adults by increasing beneficial bacteroidates and bacteroides while reducing firmicutes. This microbial shift, especially in individuals with a BMI under 26, is linked to glucosinolate metabolism and promotes improved energy metabolism and gut function. While broccoli is definitely a healthy choice for most people, you and I need to be more careful if we're dealing with certain medical conditions. What's healthy for one person might cause complications for another, and that's exactly the case with broccoli. So before you add another serving of broccoli to your plate, especially if you're managing a chronic health issue, make sure to talk to your doctor or a licensed dietitian. They'll help you figure out what's safe and what's not based on your body. Your health isn't one size fits all, and neither is your diet. In this amazing video, we learned about all the health problems and when we should avoid eating broccoli. But did you know that there are many ways to protect your health? Want to find out more? Watch 9 best breakfast foods every diabetic should eat. Or watch 1 cup turmeric and ginger water daily does this to your body. Watch one, or even better, watch both. Do you eat broccoli? Let us know in the comments below.